Hi guys, my name is Dr. Darrell Ong. I'm a dentist and I work at Dental Designs Clinic at Raffles Place. Today, I'm going to be talking to you guys about gum recession. So, I think gum recession is a pretty prevalent thing among most of the population. Even I myself, I have one or two spots that have gum recession. So, in front of you on the screen is a patient I treated many years back. And you can see straight away, there are multiple areas where the gums are receded. And how do you tell, right? So if you look at the teeth carefully, the tooth is made up of two portions, right? So there is the white portion, which is enamel. So when you and I smile, that's what we mostly see, right? And then there is the yellow portion, which makes up the root area. So that area typically is embedded within the gum and the underlying bone housing. So here you can see, from the left to the right side, there are multiple areas where, the gums are receded. Of course, on the lower left and right, he has these two little metal buttons which are sticking out just because he was undergoing alignment, or rather the Invisalign process. So those, ignore that for now. So those are just there for the Invisalign, all right? So now, I think the first question we have to ask is, well, what causes this gum recession? And is it of any danger, to me or to you as the patient, right? So the typical causes of gum recession are very much hard brushing. So, in especially in Asia here, we have this mentality or this mindset of like, oh, if I clean the floor, if I don't scrub it hard enough, it's not going to be clean, all right? And it's the same concept or same principle that we apply to our teeth as well, right? If I don't brush hard enough, I don't feel clean, or locally we say we don't feel shook, right? But you see, gums are essentially skin, right? It's just skin, but it's just pink in color. So imagine this. If I take my finger and I gently rub my hand like that, I rub it like 100 times, 1,000 times, nothing's going to happen. Now, if I use a lot of force and I go this way, right, very soon, within the next, 2-3 minutes, the area might become red, and then within the next 5-10 minutes, it's going to be, I might get a blister over there. So it's the same thing, right? In our mouth, the gums are exactly like skin. If you traumatize it by, brushing very, very hard, then what happens is, little micro blisters form, and then soon and later on, the gums actually do recede upwards or downwards in the case of the lower jaw. So, mechanical trauma, or rather hard toothbrushing, that's one of the chief reasons why people have gum recession. Another reason, of course, is gum disease, right? So, when you have gum disease and the underlying bony support is being destroyed by all this bacteria, once the support is destroyed, the gums naturally do follow up as well. So for those kind of cases, you do need to treat the gum disease in order to arrest or stop the problem from getting worse. A last common reason is actually malpositioning of teeth, or rather teeth which are positioned outside of the envelope of the jawbone. So some of us, we're all not born perfect, right? So some of us are born with teeth which are a little bit mispositioned or a bit misaligned. And within this subset of people, sometimes these teeth are pushed out of the jawbone or the jaw bony envelope. So when that happens, because the tooth is moved out of the jawbone, the bone becomes very, very thin to the point that sometimes it disappears. And when it disappears, then there's nothing there to support the gum tissue, and the gum tissue naturally will recede or shrink as well. Okay, so we talked about the causes, all right, and the next question we need to ask is, okay, so I have a bit of gum recession. Is it going to hurt me? Is it going to cause my tooth to fall out, to drop out? Not necessarily so. So gum recession in it by itself has pretty much never caused anybody to lose a tooth. It actually is an indirect cause. So how so? So, for example, if you look at this patient over here, right? So, because the gum recession, it's going further up this way, right? Further going up and up and up. Now, I don't know about you guys, but if you ever tried brushing, the lip area, so all the way inside or all the way down below. So, in other words, somewhere within this region or even at the bottom here and the bottom here. It's actually really, really uncomfortable, right? If you've ever tried it. Why? Because the tissue or the skin around the blue region, it's just very, very soft and very, very movable. It has to be like that because when you and I talk, we need to move our lips in order to speak and pronounce different words. Now, the problem is when the gum margin, or rather when the gums around the teeth, all right, they do move upwards, or they move all the way up until they are in the region of that soft, movable tissue. What happens is that it becomes actually pretty uncomfortable to brush the margin around the teeth, And the margin around the teeth, arguably, it's one of the most important areas to brush is because that area is where bacteria loves to hide, right? So, whenever dentists say brush your gums, you don't actually mean brush all the way up. We actually mean brush between the margin of the gum tissue and the tooth. Margin between the gum tissue and the tooth. Margin between the gum tissue and the tooth. All right? So you can imagine this. If the gum margin recedes further and further and further up, or further and further and further and downwards, to the point that you have to start brushing around the lip area, then it becomes very uncomfortable. So if it becomes uncomfortable, your tendency is not to brush properly. If you don't brush properly, you get bacterial accumulation. Once you get bacterial accumulation, then you get gum disease. And then when gum disease sets in, that's where you run the risk of actually losing the tooth. So you see how recession actually brings you one round instead of gum recession leading directly to tooth loss. Okay, so so in that sense, gum recession is kind of like a little bit of a risk factor, right? Now, of the next question, the next logical question to ask is, well, okay, right? So if hard brushing is really pretty much the main cause of this gum recession. If I control it, will things get worse? Will it get better? Well, unfortunately, things won't get better. Oftentimes, what you've lost is just lost already. But if you can control the root causes, no pun intended, then yes, this condition should stabilize. It shouldn't get any worse. All right. However, of course, if you look at those large cohort studies, they would tell you statistically, people that have recession tend to get worse with time. All right, and it is very, very much anticipated because we're all humans, right? So sometimes when you're brushing your teeth, you're not exactly conscious. You're kind of thinking, your mind is wandering somewhere else, and unknowingly you brush hard, and lo and behold, the recession gets worse. Okay. Now, in terms of treatment options, now in the market nowadays, there are many options available in terms of soft tissue grafting, in other words, gum grafting, right? So the gold standard, of course, is to use your own tissue. All right, so very broadly or very simply speaking, we go to the roof of your mouth, cut a small piece of tissue, pretty much cut and paste, okay? Now, in certain cases, we actually use a soft tissue substitute. In other words, we use tissue from an animal source, or we use tissue from a human donor source. Now, I'd like to assure you guys that all these external sources are void of any cellular nature, and it's pretty much just a matrix that is there to help your own gum tissue grow down. Now, when do we use what and why? Now, that one, of course, is a different conversation altogether. But I would say, in general, the gold standard is still your own tissue. In certain scenarios, certain isolated scenarios, we will actually push, or rather tell you that, hey, a substitute might be viable, and we do not need to create an additional surgical site and take tissue from the roof of your mouth. Okay? So I hope in the last 5 minutes you guys gain a little bit of knowledge on what gum recession is, what causes it, as well as is it going to be a danger to me, and do I need to treat it, right? If you do have any further questions, I do advise for you to visit your local dentist and find out more exactly about this gum recession and whether or not you need to get it treated. For more little bits and information about dental stuff, tune into our future episodes of Before and Beyond. For now, bye-bye.